Clinic and Research Center. It's not just an institute for me. It's a legacy. It's an institute which gave me my foundation of ophthalmology. So I don't consider Prabha as a workplace, because having been student here, I treat them as my alma mater, and I'm very grateful that I have been given opportunity to work in this institute. And for any ophthalmic consultant, for that matter, what we look for is institute which is ethics based, the practice which is ethical. Patients are treated as individuals and not a case number or a surgical number. Prabha Clinic is based on three basic pillars: tradition, trust, and technology. These are the three basic foundations on which the whole institute is based and work together. So tradition, coming to the tradition part of it, Prabha Clinic is 86 years old institute. Even before independence era, the institute was founded, and this is their third generation of ophthalmologists who is taking it further. It is one of the oldest private eye care setup in India, and the patient do come with this word of mouth, and the generations of patients are being treated here. Me being a pediatric ophthalmologist, when I see the kids coming to my OPD, most of them are accompanied with their grandparents, and they tell me that how they were treated by Dr. Krishnamurthy and Dr. Narayan Murthy and all these stalwarts in the fields of ophthalmology, and they still carry that ethos and that connect with Prabha, which in spite of 8 decades later, they still find Prabha and come to Prabha and get treated here. So it is our privilege that we get to work in this institute with a great legacy. Ophthalmology. We are so grateful for the management of Prabha Clinic that we do have world-class instruments, technology, whatever is available at this point of time, even in America, Europe, in all the best possible institutes in the world. All those facilities are available in-house at Prabha Clinic, and all thanks to the management who are fast movers, and they do have first mover advantage in adapting most of these technologies. So we do have world-class microscopes, world-class phaco machines, world-class diagnostic instruments, and these all technologies do help us consultant to deliver the best possible clinical care and to aid for our diagnostic and even the therapeutic clinical and surgical skill sets. The third most important pillar is trust. Trust, me being a doctor, I think the best achievement for me would be to gain the trust of my patient, and 10 patients coming to me with the word of mouth being spread by that one satisfied patient. So Prabha do carry the the third most fundamental foundation of trust, and each individual is treated as a patient and not just a case number or a surgical number. My teachers, they used to tell, if you treat a disease, the person gets better. If you treat a patient, a person as a whole, the whole family gets better. So that way, that legacy and that kind of trust is always being carried through all the teachings and learnings what I have done in Prabha Clinic.